Healthy diet menus for you, and today I want to talk to you about the healthiest treatment of gestational diabetes. Gestational diabetes is a common condition that affects women during pregnancy, and you tend to get diagnosed with it about your 24th to 26th week. If you have previously had gestational diabetes, your doctor will typically test you a little sooner. My own personal situation is I had it with the first pregnancy, and so the doctor checked me, a couple weeks earlier, probably around my 18th to 20th week, and determined that I had it. So if you've had it before, you're probably likely going to get it again. And additionally, there's a link between gestational diabetes and type 2 diabetes in that it is common for gestational diabetics to get type 2 later on in life. Appropriate treatment for gestational diabetes is best done with exercise and diet, and regular daily exercise is extremely important to controlling your weight and your blood sugar. When you are pregnant, you need to obviously check with your physician or your obstetrician, but you can get regular daily exercise, and that will help you control your blood sugars, because your body, when you're walking, when you're exercising and your heart rate's up a little bit, it tends to use the glucose that's in your blood and help you control your blood sugars. So in addition to daily exercise, you need to follow a diet of the right foods and portions. Portion control is extremely important, and it's best done with a gestational diabetes meal plan. So we provide gestational diabetes meal plans at healthydietmenusforyou.com. But one of the important things is to balance your carbohydrate out throughout the day, and to not eat too much carbohydrate early in the morning, especially like fruit juices or fruit early in the morning. And to eat the right amount of carbs and the right amount of protein and fat, so you don't gain too much weight, but you gain appropriate weight and that your baby grows like you want it to. Eat a small breakfast that's low in carbs, usually about 30 grams of carbohydrate, and consume 2 more small to moderate meals, usually about 600 to 700 calories. Eat a few snacks throughout the day that are appropriate. Nuts and low-fat yogurt are a good example. So nuts would be a protein and a fat, and some low-fat yogurt would be like one starch exchange. And that allows you to have some protein, which keeps you from feeling so hungry all the time. And the fat in the nuts is a very healthy fat. It's monounsaturated, and that's very healthy for you. And then the low-fat yogurt gives you that little bit of carb to continue to burn throughout the day. And when you're eating it a little bit throughout the day, your body uses it a lot better than if you give it to them all at once in 3 large meals. With proper disciplined eating habits and exercise, you can control your gestational diabetes. I'm not saying you can cure it. I'm just saying it can be controlled, and that you can probably even manage it without using too much medication. Correct management will control weight gain and blood sugars. You don't want to gain too much weight yourself, and you don't want to have an overly large baby. So for more information, come and check out our website. We have lots of informative articles, and sign up for our free email list and get tips and tricks. And we also have a 3-month eating meal plan that is complete with a breakfast, lunch, dinner, and snacks for gestational diabetes mom or mom-to-be to use in their treatment and keep you healthy. Thanks for your time.